I asked my patients an uncomfortable question during their 1 year post-surgery checkups. I asked them, if you could go back, would you change anything? Honestly, I expected someone to mention the pain of the first few days, the tediousness of rehabilitation, or maybe that strange feeling of having an artificial part in your body. Instead, 80% of them gave me the exact same answer. An answer that surprised me, and one that should make you think very carefully if you're sitting there watching this video, dealing with your pain, trying to find the courage to pick up the phone. Hello everyone, I'm Dr. Lorenzo Castellani, an orthopedic surgeon specializing in shoulder, hip, and knee surgery. In my practice every day, I see people just like you, active, well-informed, and often in the prime of their professional careers. People who aren't afraid of physical pain but are terrified of making the wrong choice. The fear that holds you back, I know it well, is the fear of the point of no return. You're afraid of waking up from anesthesia and thinking, what have I done? I was better off before. So, let's get back to that question I asked my patients. The number one regret, the one I hear repeated almost with anger, is simply this. Doctor, my only regret is not doing it sooner. I wasted 3 years of my life limping. I gave up skiing with my kids for 2 winters, thinking I was protecting myself, and now that I'm fine, they're all grown up. It sounds like a cliche, doesn't it? But let's analyze it from a medical and rational standpoint, because there's a science behind this regret. Many intelligent patients, and maybe you're one of them, fall into the status quo trap or the mindset of holding out as long as humanly possible. The reasoning is, as long as my original joint, my own bone, holds up, I'll keep it. I'll get surgery when I can't walk anymore. This is a huge strategic mistake for anyone who wants to maintain a high-quality active lifestyle. So why isn't waiting always the right choice? First, muscle atrophy. If you limp for 2 years, your muscles get weaker and they shorten. When I operate, the prosthesis will be perfect, but the engine that has to move it will be seized up. Recovery will be slower and more difficult. Second, postural compensation. To protect the bad joint, you damage the others, or your back. You adopt a posture that will then be difficult to correct. You arrive in the operating room as a puzzle of aches and pains. You don't just have one joint problem anymore. Third, bone quality. Operating on a joint that's completely destroyed, as rigid as concrete, is technically more complex than operating on a joint that still has some range of motion. But there's a cost that can't be measured on x-rays. It's the cost of a life lost. If you're between 50 and 65, you're in the golden age. You're still physically strong, but you have the maturity and often the financial means to enjoy life. Travel, sports, free time. Giving away 3 or 4 of these years to pain, waiting to be old enough for the prosthesis, is a bad investment. No one will give you those years back, not even the best surgeon in the world. But doctor, what if I'm not satisfied afterward? It's a legitimate fear. Surgery isn't magic, it's medicine. Risks exist. Anyone who says otherwise is lying. But let's look at the numbers. Modern prosthetic surgery, especially for the hip and knee, has very high success and satisfaction rates when performed by expert hands and on well-prepared patients. The risk of being dissatisfied with the surgery is infinitely lower than the mathematical certainty of getting worse by doing nothing. My goal today isn't to convince you to have surgery tomorrow. My goal is to get you to stop enduring in silence, thinking it's the right choice. It's not. If pain is making decisions for you, if you decide not to take a walk, not to catch that flight, not to play that game because of your knee or hip, then it's time to talk. If you want to evaluate your specific situation with no obligation, but with the seriousness your health deserves, contact me. You can call my secretary and ask for Annalisa at the number in the description, or visit my website at www.chirurgiaarticolare.it to better understand how I work. Don't let your next regret be that you waited too long. I'm Dr. Lorenzo Castellani, and I'll be waiting in my office to get you moving again.